Everyone, and welcome. This week we're stepping into the world of epidemiology, which might sound like a complicated word, epidemiology, but it simply means the study of who gets sick, why they get sick, and what we can do about it at the level of populations, not just individuals. So, unlike a doctor who treats one patient at a time, an epidemiologist looks for patterns across groups. Their job is to ask, why are more people getting asthma in this neighborhood as compared to that one? Why are certain health problems rising while others are going down? Here are some key terms, because in order to do that, to ask these questions and to answer them, we use a few important terms. Incidence. Incidence means new cases, how many people get a disease in a specific time period. Prevalence means all cases, old and new, how widespread the condition is right now. Morbidity refers to illness or poor health, not just the presence of a disease, but how it affects people's lives. Mortality is death. It tells us how deadly a condition is and for whom. So you'll see words like, what's the mortality rate? We'll come back to these all semester, so don't worry if they feel new for you at the moment.
Take a look at this image of the bathtub. It explains the key terms that I just discussed. Prevalence is the bath water, so it's made up of both the incidence, the amount of tap coming out of the faucet, and the amount of people who have recovered the steam, minus the mortality rate.
Now we're going to look at the story of John Snow and the cholera map. So let me take you back to 1854 London, where a man named John Snow noticed that people in one part of the city were dying of cholera, a disease that caused extreme dehydration. At the time, people believed disease came from bad air, but John Snow mapped the cases and traced them to a water pump on Broad Street. He removed the pump handle and the outbreak stopped, just like that. No microscope, no lab, just careful observation and a map. That's epidemiology in action. But here's where sociology comes in, because after all, we are in a sociology department, right? Epidemiology tells us where disease is happening. Sociology asks us what's going on in the housing, the jobs, the transportation, the neighborhood that's creating health risk. The biomedical approach says, let's treat the disease. The logical approach asks, let's understand the conditions that led to the disease and fix that too. So this course isn't just about viruses or charts. It's also about people, places, and patterns. It's about seeing the bigger picture of health and your place in it. And that's how you get someone like myself, who is a social epidemiologist. We put 1 + 1 together to make 2. So in this course, epidemiology and global health, don't be afraid of that big word, epidemiology. You got this. We're going to break it down and we're going to learn it piece by piece, step by step together. I'm here for you. Reach out whenever you need me.